increase in online learning and remote work has given rise to excessive screen time for both adults and children. In fact, the behavior has seen a rise in symptoms associated with attention deficit hyperactivity disorder, that's also known as ADHD. Professor Renata Schoeman is from the South African Society of Psychiatrists and joins us now to elaborate on this condition. And Prof, it's great to see you. Thanks so much for making time for us here on the AM Report. We've always known that, humans as social beings need face-to-face contact, physical contact, so to speak. And now we're seeing the impact of being so far apart from each other.
Yeah, part of this of trying to stay connected has seen this rise of up to 80% in how much time we spend on screen. And obviously we're working from home and we're schooling from home, but people also shift their social gears online, which adds to the problem that we're currently seeing.
Sure. And are we able to quantify the extent to which, this being apart, even though we're connected virtually, is actually impacting people's mental health? I mean, we're focusing on ADHD now, but I imagine the kind of, call it ailments, are quite a long list.
Yeah, it's difficult to tease out exactly what is what, because we're sitting with the consequences of the lockdown per se, the emotional and the financial impact that it has on people, but also then the screen time. So we have been seeing a rise in depression, anxiety, burnout, Zoom fatigue, but now we're also seeing a definite increase in patients that's presenting with ADHD or ADHD-like symptoms. So either patients that's newly diagnosed with ADHD or those that think they might have ADHD, but it isn't, or those that was already diagnosed with ADHD and the symptoms really aggravate now because of the excessive screen time. Because excessive screen time has a direct impact both on your neurobiology in your brain and the physiology, the connections and how your brain is operating.
Yeah, so where do you think the problem actually is? The fact that we're spending so much time engaging with our screens, or the fact that there's such a lack of physical contact? And I imagine that's actually saying the same thing in different ways.
It is saying the same thing in different ways, because in a sense, using screens help us to remain connected, even if it's a little bit artificial. We don't have the close contact, but at least we're not completely isolated. But it also contributes because of the screen, because of the way the changes on the screen affect your neurobiology. And then also because you're on the screen the whole time, we're more sedentary, so we do not exercise enough. And that leads to a bunch of other medical problems, but also negative impact on your mental health.
For those wondering whether they are now dealing with these kind of strains, ailments, what are the signs that perhaps somebody needs to look into whether or not they might have developed something like ADHD because of the amount of time they spend in front of the screen?
Okay, so you won't develop ADHD. ADHD is a neurobiological disorder, so the screens won't cause ADHD, but it can cause symptoms such as ADHD. So if you struggle with inattention or memory problems or learning problems or irritability and sleeping problems, you definitely cut down on the amount you spend. You also can see as warning signs if someone has remarked that you're incessantly on your screen, you don't talk to them, you don't listen to them. And also if you find that your default is whenever you have a moment for yourself that you reach for your screen, and that you literally cannot function without it. It's also a good indication if your quality of relationships deteriorates. So you do not talk to your children or your partner, you do not play games with them, and even if the cell phone accompany you to mealtime.
Sure. I've heard of many parents grappling with how to respond to their children's behavior with the screen. When should parents start to worry? In other words, what should they look out for?
So the first thing what a parent should always remember is you need to be the role model. You can't tell your child to cut down on the screen if you are absolutely stuck to yours. And secondly, you need to make sure that there's alternatives for the child available. If there's only a screen and they don't have books to read or, board games to play, it's going to be very difficult. Secondly, I want to encourage parents. What is for me a warning sign is children stop being active. So they don't want to go outside anymore. They should be active every single day. And some of the newest studies, although we always say 30 minutes of exercise 5 times a week, some of the newest studies have shown that in the younger children, they need 20 minutes 3 times a day to really help them regulate their energy and their emotions. So also when you see your child becoming withdrawn or more irritable, it should be a warning sign for you, and also when they take the screens to bed. And for adults, if you see that your sleeping pattern deteriorates or your mood or you become more anxious, that might also be indications that you need to replace your screen time again with healthy alternatives.
Sure, important things to look out for there. I can't help, Prof, but notice the distinction you made in correcting, the framing of my previous question. You say that screen time won't lead to ADHD, but could cause ADHD symptoms. What's the difference?
So ADHD is a diagnosis. So ADHD needs to be present. It's a neurobiological disorder throughout your lifespan. So we see symptoms of ADHD already in childhood. It's often missed and also often not diagnosed until the child is older or even in your adult years. But if we look back over time, we will see that it's there since childhood. And it's a cluster of symptoms of a constellation of inattentiveness, hyperactivity, impulsivity, where you need a number of symptoms in each of the 3. And it also needs to be present in more than one environment. So at home, at work, at school, so not only from 8 to 5 on a work day when you're at work, but often when the demands in the environment change, that's when the patient starts struggling, and when they struggle with their functioning when it is diagnosed. But the screens then can aggravate the symptoms and can also highlight the problems that someone might have had in the past, which in a way is a good thing, because then if the symptoms become such an interference to the person, they might actually seek professional advice and get treatment for something that was there present before. But a screen can't cause a neurobiological disorder as we understood ADHD as a diagnosis. But once again, it can be confused with ADHD because it causes inattentiveness and the difficulties with learning and memory.
Sure, a lot to consider. Thanks very much indeed for helping us break it all down. Really do appreciate your time. That was Professor Renata Schoeman from the South African Society of Psychiatrists. Once again, thanks very much indeed.